Hello. Is the Mental Health Act racist? Today I'm going to be looking at numbers per 100,000 people from different ethnic backgrounds who are detained or sectioned under the Mental Health Act. I'm then going to go on to look at the recent independent review of the Mental Health Act. My name's Dr Beth Colby. I've got some data here that was published on the 26th of May this year from the government. It's from gov.uk. It's the number of detentions under the Mental Health Act. Important points are mentioned. In the year to March 2019, black people were 4 times as likely as white people to be detained under the Mental Health Act. Out of 16 specific ethnic groups, black Caribbean people had the highest rate of detention out of all ethnic groups, if groups defined as other were excluded. Right, here I have some information on rates of detention. That's number of people from a particular ethnic group detained or sectioned under the Mental Health Act per 100,000 of that population. So here we've got Asian, black, mixed, white and other. And the top line is 2017 to 18 and the next line is 2018 to 2019. You can see that the black line, that group are far more likely, black people are far more likely to be detained under the Mental Health Act than white people. You've got Asian there, mixed there, and this is others. Now, when they broke it down into 16 different ethnic groups, I have some of them here, and black others the biggest, but we're going to exclude that because we don't know what it is. But out of the black groups, we've got black Caribbean are the highest, and then they go into other black groups. This one is mixed other. And when we go to white British, it's here. Now, the interesting thing here as well is it's actually lower in people of Chinese origin. One could ask lots of questions from that data. What's the prevalence of mental illnesses in different ethnic populations? What's the health-seeking behaviour like? Does mental illness present itself in different ways in different cultural backgrounds? But I'm not here to talk about that today. Going on to the independent review of the Mental Health Act, this was published in December 2018. The purpose of the review was to look at 3 things. One was the rising rates of people being detained or sectioned under the Mental Health Act. One was processes that are out of step with a modern mental health care system. But the second one, which we're looking at today, is the disproportionate number of people from black and minority ethnic groups detained under the Act. But just looking at the UK data shows it's clearly that people from a black background, but also other Asian and minority ethnic backgrounds, are more likely to be detained under the Mental Health Act than somebody who's white. The review sought the views of patients, carers, relevant professionals, and also affected organisations in producing recommendations. So there was an African and Caribbean group set up with prominent people from African and Caribbean heritage under the following terms of reference, which I'll read. The group would make recommendations designed to ensure that people of African and Caribbean descent with mental health challenges receive the treatment and support they need, when and where they need it. That they're treated with dignity and that their liberty and autonomy are respected as far as possible. To achieve this, the group would give due attention to the implementation and practice of the Mental Health Act as experienced by people of African and Caribbean descent or heritage. Identify and critically evaluate a range of relevant evidence and data to support thinking and recommendation development. Identify and critically appraise aspects of relevant legislation and consider issues that may particularly impact people of African and Caribbean descent. Identify effective practice and propose solutions to identified issues which will work in the best interests of people of African and Caribbean descent. As I said, the final report of the independent review of the Mental Health Act 1983 was published in December 2018. It was entitled Modernising the Mental Health Act, Increasing Choice, Reducing Compulsion. That's where people are compulsed necessarily detained under the Mental Health Act. In the introduction and executive summary, under the heading Supporting People from Ethnic Minority Communities, it was stated one of the most troubling and difficult areas we have considered is the fact that those from ethnic minority communities are far more likely to be subject to compulsory powers under the Act, whether in hospital or in the community. Even amongst that group, Black, African and Caribbean men are significantly overrepresented. The profound inequalities that exist for people from ethnic minority communities in access to treatment, experiences of care and quality of outcomes following mental health service care are long-standing. There has been much anxious thought why this should be the case and why this group does not have adequate access to or else is reluctant to use pre-crisis services. The answer, although not properly understood, is multifactorial, involving long-standing experiences of discrimination and deprivation, with a lack of understanding of the human dynamics of what is happening and some crucial gaps in trust between service users and providers. We are in no doubt that structural factors which engender racism, stigma and stereotyping increase the risk of differential experiences in ethnic minority communities. There is no single or simple remedy to resolve this situation, which is not unique to the health service in general or mental health services in particular. A similar and equally depressing picture can be painted within our schools or criminal justice system or other aspects of modern society. No other issue has made us more aware of our fallibility than this one. With that in mind, we still hope that our recommendations will at least be a positive contribution. Be it as individual practitioners or system leaders, what is needed is honesty about the scale of the challenge, a recognition that current approaches are not delivering for people with ethnic minority backgrounds, and a firm commitment to work together with service users, carers and communities. This starts with having due regard for equality, as stated in the Public Sector Equality Duty, which is why, amongst other measures, we strongly support the creation of an organisational competency framework to tackle racial disparity, which has as its core service user and carer accountability measures designed to address this. The OCF, Organisational Competency Framework, as I said, should focus on several core areas of competence: awareness, staff capability, behavioural change, data and monitoring, and service development. It is expected that there will be a role for regulatory bodies to monitor compliance and attainment at a national level, with patient and carer representatives having an active role in the assessment. One of the recommendations from the experiences of people from ethnic minority communities is as follows: an organisational competence framework and patient and carer service user experience tool should be implemented across health and care services. This should build upon ongoing work by NHS England to develop the Patient and Carer Race Equality Framework, PCREF, that's a mouthful. Regulatory bodies such as the CQC, which is the Care Quality Commission, should use their powers to support improvement in equality of access and outcomes. The EHRC should make use of their existing legal powers to ensure that organisations are fulfilling their public sector equality duty. Culturally appropriate advocacy should be provided consistently for people of all ethnic backgrounds and communities, in particular for individuals of Black, African and Caribbean descent and heritage. Safeguards should be created so that patients are able to continue religious or spiritual practices while detained in hospital. These should prevent the use of restrictive practices that limit a person's access to religious observance. In line with the NHS Workforce Race Equality Standard Programme, greater representation of people of Black, African and Caribbean heritage should be sought in all professions, in particular psychology and occupational therapy. People of Black, African and Caribbean heritage should be supported to rise to senior levels of all mental health professions, especially psychiatry and psychiatric research, psychiatric nursing and management. Behavioural interventions to combat implicit bias in decision making should be piloted and evaluated. Data and research on ethnicity and use of the Mental Health Act should be improved, with all decisions being recorded and reviewed consistently by organisations involved in the process, in particular criminal justice system organisations and tribunals. Funding should be made available to support research into 1. The issues that lead to mental disorder in people of a wide range of ethnic minority communities, in particular African and Caribbean individuals, and 2. Interventions which improve outcomes. Lastly, a call for research should be made into tailored early interventions for African and Caribbean children and young people, particularly those at risk of exclusion from school. Thank you for listening. I hope that's been of interest to you and will stimulate further thought and debate.